Hi, this is Curtis Alexander. I'm a pharmacist. In today's video, what I'm going to be talking about is Ginkgo biloba and its side effects, but also more importantly, its drug interactions. I don't feel those are talked about enough because there are some that you need to be aware of. Okay, so I originally got this question from a viewer who was asking about, hey, I have a family history of Alzheimer's. Can ginkgo help prevent Alzheimer's, basically? And while there's some promising research, A, it hasn't been proven to do that, but B, the next part of the question was, is it safe, which is a great question. So overall, ginkgo, to me, you look at the studies, you look at everything put together, yeah, pretty safe. There are some things you need to be aware of. The most common side effects you're going to see are usually stomach related, so people will complain of nausea. There can also be some stomach cramping. Couple of the other ones we can see is dizziness and headache, and I put asterisk next to those because one of the things that we know ginkgo does is it can increase blood flow in the body, and that's one of the reasons why it's postulated that it can help with something like Alzheimer's. But because of the increased blood flow, we can see dizziness and headache. At least we believe that's why. A couple of the side effects, and that's possibly due to the increased blood flow. Now, that's kind of it for side effects. I don't see a bunch more than that. I didn't see a huge amount of side effects in the studies if you look at it. But the second part of the equation is, while it's not a side effect, there's some drug interactions that you need to be aware of. One of which is if you take any sort of blood clotting med, blood thinners. There's a lot of them on the market. Just a couple examples. Warfarin, Plavix, Eliquis, we have some of these medications. You also need to be careful with MAOI inhibitors. That stands for monoamine oxidase inhibitor. It's not a class of drugs that you're going to see used a ton, but one that is used a ton is the SSRIs. Here we're talking Prozac, Zoloft, Celexa, some of those medications. There's a possibility of a drug interaction with ginkgo. Is it serious? No, I don't think it's serious, but it is something you and your doctor need to be aware of. The other one, and it's not necessarily quote unquote a drug interaction, but if you have diabetes, it's something you want to let your doctor be aware of. It's not a huge interaction per se. You do want to watch. We have seen in studies some alterations in the liver enzymes. So if yours come back a little wonky, then that's something to let your doctor know. There was a fairly significant drop in blood pressure in people who were taking nifedipine. Nifedipine is a calcium channel blocker used to treat blood pressure and to lower it. But when you take it with ginkgo, we can see bigger drops. So be careful with that one. We've also seen interactions with Viagra. Again, we have the increased blood flow, so that's where that interaction is coming from. Then Tegretol. Okay, this is only seen in animal studies. Tegretol is an anti-seizure medication. When it was given in animals that were taking Tegretol and they gave them ginkgo, they did see an increase in seizure risk. So the theory is, if you're taking Tegretol, be careful taking ginkgo. Again, two things. These are animal studies, so they don't necessarily equate to humans. And also, they gave them the Ginkgo biloba seeds, okay, not the extract that we commonly see over the counter in this country. So keep those things in mind. Again, overall, ginkgo to me is very safe. There's just some precautions you have to take as far as side effects, but even more so with the drug interactions. So if you've taken ginkgo, let me know in the comments. I don't respond to all of them as I do more videos, but I promise I read each one. Let me know, have you taken it? Were there any side effects? Did you experience any negative things with it? And if it helped you, I love to see those things and hear about them. The more the merrier in that regard. So I hope this was helpful, and I will see you in the next one. Thank you.